under the Universal Health Coverage UHC program in are decrying unpaid allowances since they were hired 2 years ago. Speaking outside the Afya House building where they had sought audience with Ministry of Health, the psychologists, led by their representative, Alexander Kinyanjui, questioned why they had not been assigned the correct cadre as per their letters of appointment, and also sought clarification on why their allowances, which have accrued to millions of shillings, had not been paid since inception. As Grace Wangoi now tells us, the clinical psychologists have now issued a 14-day ultimatum for their grievances to be resolved before taking further action.
In the wake of growing awareness on mental health disorders and the growing need to strengthen how mental health cases are handled in the country and a critical support system in this capacity, clinical psychologists have come out to decry frustrations by the Ministry of Health. While staging a silent protest outside the ministry headquarters at Afya House, the professionals led by the representative Alexander Kinyanjui painted a grim picture of how they have been taken on rounds by Ministry of Health officials while following up their unpaid allowances, which have now accrued to a staggering 180 million shillings since 2020.
And now the process has been hindered, and we have received threats, insults and intimidation from the office of the Director of Human Resource. So we are calling on the President to come and aid us in fighting for our rights and justice.
Several letters later of back and forth communication between the psychologists and their employer, and no resolution has been found. According to their letters of appointment, the clinical psychologists should have received health risk allowance of 3,000 shillings per month, health service allowance of 20,000, another health service allowance of 15,000, emergency call allowance of 10,000 shillings, and an extraneous allowances per the county they have been posted to. However, since they received their salaries in November 2020, the allowances have never been factored in.
This process, we have done our due diligence, visiting all offices from SRC to the PSC, Ombudsman, Labour, and now we have reached to this point. These mental health practitioners have sacrificed a lot during the COVID period, and we have also lost one of us last year, and this is very, very painful for us. So we are requesting that our voices be heard. We are calling on the President to come and listen to us and hear our plea. We are calling on the Deputy President, who is passionate about youth, who is passionate about mental health and public service, so that these people can resume their work and continue providing mental health services in all the 47 counties.
The psychologists have now issued a 14-day ultimatum to the employer, the Director of Human Resources at the Ministry of Health, to resolve their grievances, which also include being placed in the right job cadre, an improvement in their terms of service to permanent and pensionable, and more importantly, the allowance arrears to be paid moving forward and be backdated till August 2020.
As mental health practitioners, we believe on decorum and decency. That's why we've taken almost 3 years, following up silently up to this point. So the next action we're going to take, we're just going to give him a 14 days ultimatum to give us a way forward. And if that is not met, we will arrange to meet with the Deputy President and the President, because even the Cabinet Secretary, the new Cabinet Secretary, is not aware of our issue. Because the issues, we use the proper channel. We take our issues through him or through the PS, former PS, Susan Mochache, and they never got to see the light of day. And now we are going to go directly to our superiors. But we are going to use protocol and the respect that we have accorded them for all those years, yes.
The clinical psychologists, who were initially 114, were hired in 2020 by the Public Service Commission under the Universal Health Coverage Program, with their initial duties being to provide psychosocial support to COVID-19 patients, but that now has evolved to psychiatric assistance in hospitals across the country. Grace Wangoi for TV News Watch.